I thank you for giving me 5 minutes, and I'm here to convey that life after orthodontics is really a wonderful thing. So, as I retired, I had an interest to travel internationally, and I also had a desire to give back. And I was trying to figure out how I could accomplish those things. As an orthodontist, our skills are not that valued internationally because the need internationally is for general dental care. These children have bombed out mouths and tremendous problems. And as an orthodontist, I searched, Smile Train and Mercy Ships, and they want 3 6-month commitments. Sometimes they want a year, and that just was not going to fit in my lifestyle. So I continued to look, and I found a program that was willing to work with me called Globe Aware. And they have programs in 26 countries on like 4 continents, and they have coordinators in these programs. And it has enabled me to travel the world and to give back at the same time. And the whole thing being tax deductible from door to door. So I wanted to explain to you how I've done this. I have done this in Cusco, Peru. I've done this in Chiang Thailand. I've done it in Nueva Ecija in the Philippines. And I'm just a regular orthodontist like you guys. I practiced for 40 years in Jersey City and Fort Lee, New Jersey. I taught at Fairleigh Dickinson. My dad was actually president of the NGAO 55 years ago. I'm a second generation orthodontist. So I wanted to be able to do orthodontics internationally, but it just doesn't really work. There isn't the need. So GlobalWare has enabled me to go to these countries, work with the coordinators. In as little as like 4 days, I'll get there, I'll shop at a big like Walmart store, buy cases of toothbrushes and toothpastes. Then I'll go, they'll have set me up for a local school. In Thailand, I moved into an orphanage for 2 weeks. But I'll go to these locations and I'll meet with the principal, talk with the teachers, and I'll present to a room full of kids. The one I just did in the Philippines was 300 students. So we do the dental education. We try to educate the parents. We educate the teachers and the principals. And the trick is, by handing out the toothbrushes and the toothpaste in these very poor communities, you get involvement and engagement, and all these students and parents come. I then do these presentations, and then afterwards I'll screen the number of kids that I think I can handle during the time I'm going to be there. So in Thailand, I did 100 kids at an orphanage. At the Philippines, I probably did about 100 kids also. I didn't do the whole 300. And then, this is my choice, you don't have to do this. I then work with local dentists. I hire the local dentists. In the Philippines, I hired 3 dentists in 3 different offices. And I basically take over their office for a day. I've screened the kids. I know what I want to do for them. I send them by bus or however to get there to the offices, and I pay to have the dental work done. You don't have to do that. What I'm explaining to you is there is life after orthodontics, a way to travel and to give back. And you give as much as you would want to give, and you get to travel and have the enjoyment of sharing this with these communities. It's a wonderful thing. The organization is called GlobeAware, globeaware.org, tax deductible, door to door. Everything you give away, you're deducting. If you want to see anything about my journey, I have an Instagram. I only started Instagram 2 months ago. I never had social media. I'm really not good at it, but nonetheless, it's my name. Drew Lombardi _DMD on Instagram, and you'll see what I've done. You'll see me presenting to tons of kids, working with orphans. These mouths are so bombed out you cannot imagine. Just teaching the parents and the principals to get the parents to stop sending the kids to school with Coca-Cola, sweet tea, sugared lemonade. I've worked with politicians locally and the principals to enact new rules at the school level where the parents are told you're no longer allowed to send your child into school with Coca-Cola and sweet lemonade. And by these simple changes, we're improving the dental health in these areas. And the coordinator, I've now instructed that they can learn to continue some of that, get the teachers to re-engage and follow up on the dental hygiene instruction. So my message to you is, there's life after orthodontics. There's a way to take our orthodontic skills on the road to do international charity work. It's a joy to do. And if you want to look at some of what I've done, Drew Lombardi _DMD at Instagram. I'll be around all day. Ask me any questions. And my last thing I want to say is, this is good for singles, for friends, for couples, young families. I was there with a family with young kids. The young kids can hand out the toothbrushes. You can do it with your teens. You can do it as an office with your staff. GlobalWare can make all of this work. I choose to live with the family, so I embed it in the community and have a real connection and a cultural experience. You don't have to. They can put you up at a hotel. It's like what your preference might be. It's a great way to give back. You can do it, like I say, as your general dental skills with our ability to scan a patient quickly and know what they need to be done. I did not do it with x-rays. These are, limited abilities, but these kids' mouths are so bad you don't need x-rays to see what's going on. Ask me if you have any questions. Thank you very much.